Sorry to hear that she can't connect. Thanks for letting me know. I will send her, of course, I'll send all of you the presentation and any notes too. Okay, so why should we do this? Well, because the grant deliverables say so, right? No, not just for that. Why is it useful for us and how can we make it useful for us? So this process assists in painting a picture of our community, telling the stories and the lived experiences, and the assessment gathers data to describe your community and how to make important contributions to meet the needs of young children and families. This also meets the guideline for your grant deliverables for current and future funding. So we have, let's see, 6 steps within, and I'm going to refer to our infographic really quickly before we move to those 6 steps. So this is the presentation that you'll get. So these steps align with the Plan, Do, Study, Act model. So this allows us to have a continuous quality improvement model that aligns with ECECD's system building goals. And there's 6 steps to organize the work within the Plan, Do, Study, Act model and process. So we're continuously planning, we're continuously acting, checking in and doing, and really revising that process. And then here's another infographic. I'm just going to minimize here, that you can see that I'll outline these 6 steps in just a moment, that you can actually just put into place into that CQI model of Plan, Do, Study, Act. So we establish our team, design a process, gather essential data, review and analyze the data, summarize the data, and then make decisions based on that. And then we continue that process going forward. Oh, I love infographics too. Thanks, Catherine. They're so much nicer than words. What do you all think? Think about that when you're actually creating your community assessment, to include things like graphs or infographics and pictures, to help tell the story and paint the picture. So it's not just about the words or just the data, that also you can make it your own and you can really make it unique and tell the story and be creative in that process of creating the report. So step 1, a community's young children and families, we want to focus on improving the quality of life for all young children and families. So we have these goals within your community, and we have a large metro community here in Bernalillo County for the most part. So it's actually really great that we have 3 coalitions to collaborate together to kind of tackle that, because it might just be too much for one. So that's really great. And then also celebrating the uniqueness of each coalition and the similarities. We'll talk about that a little bit later. So 2, this helps us with program decision and planning. So program decision making and planning, I'm sorry. And it provides the basis for making decisions, from developing your strategic plan and how to design your plan and implement and align services. This guides us in program education, gives information to educate the community and beyond on strengths and characteristics to improve the lives of young children and families. This can help us with community engagement. Both family dialogue circles and our community assessment can support and community engagement by assisting to build relationships with community partners or families for collaboration. And we can use this data that we collect to respond to trends and changes. So we can identify themes, we can identify the gaps or the disparities within communities, and we can respond to those trends and changes. It really, collecting this data assists us in recognizing and anticipating trends within your community. And of course, for the future, it can help us apply for funding. So this foundation provides us critical data and information to strategically prepare for other grant applications and or to fulfill our deliverables within this grant. Any questions so far? Okay, great. What did I just do? Okay, there we go. Sorry. It's like, where did that go? So our process here, we can think about how will we conduct a meaningful community assessment that is simple and doable and not overwhelming. The Community Assessment Toolkit is a framework that's designed to provide your program and partners with usable tools and guidance to make this process meaningful. And this will help organize data to better inform your community's collective efforts. And it also helps you to streamline the process so that leaders can share the process. And guides assembly of the community defined data report. And there'll be 6 strategic steps outlined in your toolkit. So I was pulling up my hard copy of my toolkit earlier. So some of us have this book as a hard copy here. And also it's available via PDF as well. So in that, and also the presentation I will share will be in detail those 6 strategic steps for how to then move forward with collecting that data and then compiling it into your report and strategic plan.
So Lindsay?
Yeah.
Okay, so in the last meeting, they were talking about all the surveys. All the surveys that were going out.
Yeah.
How do the surveys fit into a community assessment? And can we use the information from the surveys in the assessment?
Absolutely. So some coalitions have already started the information gathering phase, whether by conducting family dialogue circles or sending out surveys or both. Some coalitions have started by trying to gather their data from already existing resources first, and then might develop a survey for any other additional questions they may need to ask, or data that they might want to collect that's unique to their coalition. And some coalitions haven't really even started the process yet. So we're kind of at different phases. And so for some coalitions that might be utilizing a survey to collect some of that more number-driven quantitative data. I'm like, wait, qualitative, quantitative, and I don't want to misspeak, because I don't want to confuse anyone. So that's where the surveys are coming from.
Okay, and what constitutes current data? So for example, we had quite a few really good community conversations before the pandemic.
Yeah.
So it's only 2 years old. If you're writing a paper, if it's in the last 5 years, that works. But does that constitute current data for this community assessment?
I absolutely love that question because I love data. And I love to look deeper into data too. There's Maria, yay, it worked. So I loved the challenge of looking further into data as well. I think that my best thinking and best guidance would be to answer that question, Catherine, is something your coalition may have to decide what's current. So you may have a discussion. Well, we had these family dialogues or whatever, we had these conversations. Do we think that there have been changes since we had them? So let's just say we had them in 2019. Well, that's pretty current. That's not that long ago. But were there significant changes Do we want to ask further questions? Might we want to continue with some of that qualitative data and those stories from then and have a picture from then till now? So it's really kind of up to you all to decide what's current, what's not. Teresa?
So I mean, and this would probably be like group specific, correct?
Mhm.
Because I mean, Cammie's going to look for something different than the people, Sarah and them, right? So that's kind of where, like with, I mean, Catherine, correct me if I'm wrong, and Diana, and if because our conversations were just mostly with home visitors and the community that supports them. Whereas the family dialogue circles were actually inviting families to come and answer these questions, correct? I mean, I don't know.
Mm-hmm. So, I'm just Googling a question real quick. Hi, Maria. I'm so glad it worked. Finally. Oh, goodness. So yes, you were going to have unique needs within your coalitions. So after the grounding poster presentation of last week, so we all know within coalitions, even if we weren't at the convening, that we created our own posters. And so we actually hung those posters up and we were able to just walk around and read them and learn what initiatives each coalition is working on. So one thing that I loved about that activity was how unique each community is and each coalition is. So we want to stay grounded in that. And so in a nutshell, for these 3 coalitions within Bernalillo County, we have Bernalillo County Home Visiting Work Group that their focus is on home visiting, of course. And then we have Cuidando los Niños, one of their initiatives. Of course, we all have other initiatives and lots other initiatives, but I'm just in a nutshell summarizing. One of the unique pieces of your initiative is supporting homeless families as well. And then with Explora, in a nutshell, one of their pieces is really integrating STEM and STEAM into early childhood, which all 3 have several other initiatives as well. But those are like the really unique takeaways that I took from the posters. So we have these unique coalitions, but what is going to be the foundational data that we all collect, that each one collects, then each coalition can think about, then, okay, wait, now I'd like to dive a little bit deeper into this, and I'd like to dive a little bit deeper into this, and I'd like to dive a little bit deeper into that. And then how do we share that too within each other? Hey, I found out this, and I found out that. So there are going to be foundational key pieces of data that we all collect, and maybe that's where we can collaborate on. And then each coalition can then expand upon that or look further into that. I'm going to get back to Catherine's question too really quickly before I get to you, Diana. So one piece in determining how relevant or current that data is that word relevance too. And then of course, you know, we don't want the data to be too outdated, right? But it's really kind of a discussion within your group too. You know, how relevant and current is that data? And does it really impact us and pertain to us now? And then the other piece of looking into data, it can be quite a rabbit hole. And I'm sitting here smiling like, oh, it's so fun, because you can look into it further and further. So for instance, if you come across a particular piece of data from, I'm going to say, ABC Early Childhood of New Mexico. So I don't like pick on any agency or any sort of organization. Did some sort of community assessment, and you thought, oh, we're going to look into that data that they collected to see if there's any relevant pieces of data that we're collecting and use some of that and reference that organization. And it says something like 50% of our children were born premature. And you're thinking, oh my goodness, 50% sounds like a lot of babies. What is going on here? So we have that conversation of, wow, I'd like to look deeper into this data. And then you find out that only 2 families were surveyed. So sometimes, especially percentages can sound like a lot, but then when you back into deeper in the data dive, you find, oh, wait, okay, maybe we would like to ask that question on our survey because we would like to have a larger sample versus just 2 families. And then another piece is to be sure we're not confusing things like rates versus percentages, because a rate of 7.4 out of 1,000 is much different than 74%. So if I just use that same example where I said, oh my goodness, 74% of our children were born addicted or exposed. Oh, wait, did I read that data correctly? It was actually a rate of 7.4 children out of 1,000. What does that mean? So it can be quite a rabbit hole, but it's really up to your coalition to make sure that that data is relevant, as well as it meets the needs, and it's, you know, a sample size that you agree with. Okay, I'm going to shoot it over to Diana. Thank you. Thanks for waiting.
No, that was great, Lindsay. Thank you so much. And I apologize if you had already mentioned this. I just may have just completely,
Yeah, no worries.
I don't know, blocked it out of my mind or just lost it out of my mind. But thinking about the connections with the grant and connected to ECECD, what level of expectation is there from ECECD for us to align with their assessments that they already have, or align with their measures, align with their overall strategic plan? Like, do we need to align in a certain way with them?
Yeah, that's a great
Yeah,
question.
is there a baseline? Is that what you're asking? Is there a baseline?
Yeah, baseline. And even like, because I know every community is different. Even within the city, there's communities within our areas. They're all different and they all have different needs. And we see that as we start collecting data. But do we need to be aware of, I guess, when we get that data, tying it into ECECD's strategic plans, their measures, and their overarching foundation? So I guess, yeah, baseline, because when you said foundational data, it just made me think of what they've already put out.
Mm-hmm. Yeah, you know, the strategic plan that you develop for your coalition will be unique to your community and your coalition. But overall, it should, you know, align towards the strategic plan of ECECD, because part of the strategic plan is the systems building grant. So there should be and could be some relationship with both of those plans, but know that your strategic plan can be very unique to your community and driven by your coalition. And really, with your liaisons, so we have Christian with Explora and Sam with Cuidando and myself with Bernalillo County. We can also explore how those align with your goals, and your strategic plan aligns with the ECECD plan, which I'm sure it will, just by nature. But that's a really great question and something to think about. And if you haven't referenced the ECECD strategic plan, you know, that could be something that's a good resource to just, you know, familiarize yourself with. But know that the grant that you already wrote for the application and goals, although can be fluid as well and can be adjusted as we go, has already been accepted. So you can continue to ground yourself within that within your original plan, knowing it can be adjusted as well, to develop your strategic plan, if that makes sense. Okay, and Catherine?
If my question does not go along with what we're already talking about, just pretend I didn't ask it, because this is all new to me too. So could we ask the home visitors in our group for the data from their program for our assessment, for part of the assessment?
Absolutely. However, being mindful of a couple of things. One, that you have permission to then, that they have permission to share it to you, and then you have permission to share it to other larger sources like ECECD, or if you apply for other grants or whatnot in the future. And then two, thinking about, we do want to tap into our Indigenous communities and gather data from there, but there is some technicalities with the Solver Nation and approval, and RJ from, it's coming to me, 8 Northern Pueblos, can't speak.
I think it's from Santa Clara. Santa Clara.
Yeah, and they represent Lanel and 8 Northern Pueblos. I just had to file, I was loading, my face was, my brain was loading. I had to search for that file for a second. Being an Indigenous person too, he also brought that up at our convening last week, which I think was really important to highlight, that it's not impossible to collect data or use data from our reservations, Pueblos, and Indigenous communities, but there is an approval process that may take some time to move through council and elders within those communities for approval. And they may even do something like, you can have, he pointed this out as well, you can have this data for your community assessment, but you may not share it with anyone else. So knowing those unique needs and pieces within communities as well, but absolutely, if you're working to gather information from the home visiting community, you can absolutely tap into your home visiting agencies and partner with them to release some information. So with that being said too, Teresa is very familiar with the support team and the data team from UNM, ECSC, Early Childhood Services Center, who are just amazing. They are so cool. And they have a lot of data. However, due to HIPAA laws, they cannot just release that data. So whatever's already been released, maybe from the previous year before. So Teresa, thinking about the home visiting reports that come out annually, that data has already been approved to be released if it's been publicly shared. But also checking in with your manager monitor just to be sure that that data can be utilized, because that can give us home visiting data from like the entire state and county by county. So just something to think about. Families are surveyed within that report as well. So
your advice would be just to ask the database to give permission, or how do we get that permission?
So if you wanted to utilize that information, I would utilize the report year before, and which has already been released, but I would make sure, maybe even touching base with your manager monitor, that and even the data team as well, maybe looping them in, that data is okay to share within your community assessment for the systems building grant for ECECD. And thank you, Cami sent some guiding principles for research within Native American communities. Thank you so much. That's a great resource. And Diana?
Yeah, I just wanted to put it out there that we have an EPI on our health promotion team, and it's like literally his job to support all of our programs. So we can tap him and ask him if he could give us specific data that we're looking for, that he has access to as a state EPI. And he can also help us create like cool data stories and all kinds of
Ooh,
stuff.
fun.
So yeah, I just wanted to put that out there before I forget that.
Yeah, thank you. So we have access to an epidemiologist from the Department of Health. I think that is really great to be able to access that resource. And Catherine?
Yeah, and that's why I was also thinking of using the resources within our group, because NAPR attends our group, and I'm sure that they have data, and then that's what we're sharing. Like if we McKinley County will have some data likely from different populations, but that we could apply to some of our communities.
Absolutely.
And so you capitalizing on what we have in the group.
I love that. Capitalizing and leveraging what is already existing, what you have access to already, how we can capitalize and leverage and collaborate together to share data, us 3 coalitions here in Bernalillo County, so we don't have to recreate the wheel. It would be such a shame for each individual coalition to go out and collect similar data and again get stuck in the silo again. So we really can capitalize and leverage and collaborate together, and not recreate the wheel. And so thinking about, you can absolutely use data from existing sources. So let me share this screen. Oh, no, wrong one. Okay, here it is. So here's the electronic version of the Community Assessment Toolkit. Close your eyes if you get seasick, because I'm going to go through a few pages quickly. And in the back, we have access to, in an appendix, here are the wonderful graphs, which we'll show you in just a moment. But ideas, this doesn't have to be, again, this is a framework, and it doesn't have to be the only places that you gather data from, but just ideas of where there's already existing. Sorry to make you seasick. I'm so sorry. Close your eyes. Okay, here they are. Just a list of key early childhood data research sources that are already existing, and they're just to give you an idea. So of course, tapping into the Department of Health and, the indicator-based information system, PED, and Kids Count, and beyond. So our local Head Starts. So I am so proud of my history with Head Start. My daughter is a Head Start child, and I was a Head Start Policy Council member, then chair, then applied for a director's position and worked at a Head Start for a few years, and such a great experience, and learned a lot about data, collecting data, community assessments, family surveys, and whatnot. And so our local Head Starts, and we're so lucky to have YDI a part of our group here today, can really help us with some of that existing data that's already been collected, that we might want to use towards our community assessment, as well as maybe how to collect that data and family stories. And they will have really current data, because we need to be collecting that on an ongoing basis within Head Start, to fulfill the deliverables within those grants as well. So that is a great resource. And I also wanted to highlight 100%. So 100% community is another place to start. And I know that 100% community recently has completed, I want to say, about 1,000 surveys within Bernalillo County. And so there's some really great data to collect from them as well, and tapping into them and thinking about inviting 100% community to be a part of your coalition, and you to be a part of their early childhood wedge. So 100% community has a focus on uplifting the entire community from the lens of education, K through 12, early childhood education, health, safety, and all of those components that support the community. So they have an early childhood group within Bernalillo County. And on that note, I'm going to go to Diana because I think you have some really good information, I think, to pass on.
I was actually just going to ask you, do you know who's leading the initiative in Bernalillo County for 100%?
Good question. I don't, but I can get that information.
Okay,
I want to say that Sam might know who that is. And
okay, and I
Catherine,
could
do you
reach
know?
out as well. Do you know, Catherine?
No, I've only heard of it happening in Valencia County. I didn't know it was
Yeah.
happening in
Yeah,
Bernalillo,
one
so-
of my
Yeah.
coworker who's on my team, well, my colleague in Valencia, or my counterpart in Valencia, she's a part of the 100%. And then I've attended a few of Dominic's presentations. I forget his last name.
Capella or something.
Yeah,
Yeah, I want to say,
yeah.
yeah.
Yeah, I'll ask around, but if you find it, let me know.
Yeah, definitely. I wasn't aware until I spoke with Sam that community or 100% was also in Bernalillo County. So
I didn't know
yeah,
that either.
let's get that. And refresh my memory of the other resource we talked about. Was it Albuquerque Kids or Kids Network? It's within the city.
The kids cabinet.
Yes,
Kids
the
cabinet,
yes,
Yeah.
the Kids Cabinet.
And that's with Sasha. Sasha Perlin is their coordinator. And Deborah is from YDI is their chair. I didn't know that.
Oh,
until she
cool.
said, yeah.
So that might also be another resource to tap into, as well as coalition members, just to think about if they've conducted any sort of data. So thank you for bringing that up. So I want you to keep in mind, just again, highlighting that there are other tools and frameworks that can be used. You do not have to use this particular model, but if you don't know where to start, this is really a good framework to use. But keeping in mind some of those themes that we talked about that we already know from the Community Assessment Toolkit is that it is fluid and you can make it unique to your coalition. So this doesn't have to be step by step, but it really does give you a nice outline framework of how to proceed in eventually moving into strategic planning. And so you may have already started using other frameworks, or you may have in mind another framework to use that speaks to your coalition, and that is perfectly fine. And again, we've kind of talked about the differences between family dialogue circles, which is our qualitative data, and our community assessment, which is our quantitative data, but also how it relates. And again, it relates by painting a clearer picture, a more inclusive picture, because just as important as the quantitative data is the qualitative data. And there are terms that we have heard a million times out there, I'm sure: data driven. We need to be data driven. We need to make data driven decisions. And my best thinking is data informed decisions. If we make only data driven decisions, we take away from the expertise sitting right in this group and within our coalitions. So we have professionals that are educated and that have lived experiences with working in communities. And so we need to use this data to inform a large part of our work, but we also have experience and expertise to bring to the conversation as well. So let's make our planning data informed, but also what we see best as professionals are hearing from our families, and what do our families really want. So we might notice in our gap analysis and our data walk that 10% of our families in Bernalillo County are homeless. And please don't take that, I'm just making that up. And we may think, oh my goodness, we have a problem here. And of course we do have a problem with that on a real note. But then as you talk to that 10%, maybe 50% of those families are really fine where they're living. They are fine living with an aunt or an uncle or a grandparent to support them while they are raising their young one and they're going back to school. So that's just as important. If we made a data-driven decision just based on that number, we may make a decision that's not informed qualitatively by the family voice. And that is really key, because we can get lost in the data. I know, I'm like, oh, I love data and I love the rabbit hole, and oh, did you see this? And oh, and then that can make me think about this, and keep going and making those connections. But we really need the family voice, just as important. And we really need your voice as the coalition. So thinking about also family voice being a member into your coalition and what that might look like for your coalition. So with that being said too, the family dialogue circles are, again, it's a framework and can be adjusted to fit your coalition's needs, but it's a series of dialogue sessions that can be facilitated to bring out some of those ideas and goals from families. So that's the difference in this. And then the Community Assessment Toolkit is a framework to design your community assessment and how to organize that data. So both are different, but one contributes to the other. And the Community Assessment Toolkit will focus a lot more on that quantitative data and pulling that and organizing that. But then how do we connect it together to paint the picture for the report? So Cami, thank you for sharing some really awesome resources. I'm just going to give you a quick preview. I already had it pulled up to share. So one of these really cool resources that she created, round of applause, is actually she took from what is in the back of the toolkit as a table or tool to think about organizing your data. And she created a live document that's fillable. So, if you just use the PDF or of course copies, it's not like a live, document that you can type in. So she actually took the time to do that. And she has different tabs here that are color coordinated. To me, this is such a great resource, but I have to say, when I was reading the Community Assessment Toolkit for myself, that was really organizing for me to go back to, I'm going to scroll my pages now so I don't make you seasick again. Oh my goodness, that's terrible. I'm sorry. Lindsay's session was really cool, but I got nauseous. So this was actually really organizing to me to flip back to, because again, I like infographics. I kind of like to dive in to things. And so what was organizing to me was actually seeing these certain data points that might give us a good idea of what kind of data to collect. This is in no way you have to collect this data list, but it's really just an idea of what might be some good indicators and pieces of data to collect that might give you some really foundational information to make those data informed decisions about when you're developing your strategic plan. So that was a piece that really helped me kind of organize myself of, so what are we even collecting here? And then moving forward with that. So Cami also brought up the data walk. So on page 10 of your Community Assessment Toolkit, there are like specific directions into how to conduct that data walk, but really it's a way to explore what the information means. So this is a time that you can bring your coalition together after you've collected the data to really reflect and learn from the data that you've collected. So you would ask yourself, like, what do you notice about some snapshots or takeaways from the data that you've collected? What are some strengths that you've noticed within your community? And what kind of questions have developed from the data you collected? So let's say, hypothetically, I don't know what this would look like, but that the 3 coalitions within Bernalillo County collaborated on some of the foundational data. Then you have an individual coalition data walk where you say, okay, now we've done this, we've collected this data, and now what more do we need for our coalition individually? And then it also might be cool to come together as 3 coalitions to do kind of a brief data walk. Like, I have more questions about this particular piece of data. What do you all think? That's a good question. But it also gives us a guide. The data walk gives us a guide so we can facilitate through the review and analyze portion of the data without getting too caught in the rabbit hole, because we can go on and on and on and look for further things, but there are some things we might want to further investigate. So this is an opportunity to discuss the collected data, to understand the relevant issues and concerns facing the children and families in your community. So it's a really great activity, and it's really an activity to analyze that data collected. Go ahead, Teresa.
So, I mean, looking at the different things that you were showing on there with the demographics and of course the health indicators, all of the different topics. So are we doing it where, like, for example, if we did it for Head Start and we fill out all of those sheets for Head Start, and then maybe what is it, Western Skies does it for all of their, not Western Skies, Western Heights, all of their centers do the same thing for all of them, correct? Okay.
Well, I think my best thinking would be that your coalition, or if you collaborate between the 3 coalitions, decides where is the best place to capture that data from. So if we know,
but like if the state gives, I mean, from my area, for the state database, I'm able to enter all this information, but I would answer all of these questions regarding the information I get from that database, correct? If I was able to access that.
you could, but I think that the collaborative discussion, my best thinking is the collaborative discussion within your coalition, and if you collaborated with the other 3 coalitions, would be where is the best place to capture the data from. So is it one pre-K center, or is it all of YDI? Where am I capturing a bigger view? And what works best to represent our county for that foundational data? And then also, again, for those unique data points that you might want to collect per coalition.
Thank you. I just have never done this stuff.
Yeah,
before.
yeah.
I don't even know.
I think that's a great question, because it's like, no. I think that's a great
Uh-huh.
question, because you could look at this and think, okay, do we each need to fill this out? And then how do we put that all together? And
Well,
like, that's like really overwhelming.
At first I thought, well, maybe Diana could do all the health.
Yeah.
Even Catherine.
Right. You're like, okay, I got this
and
covered.
I could do this part, and just
Yeah.
like it all up,
And we're gonna actually use the rest of the time here for in just a second here to move into strategic pre-planning, what we're calling foundational strategic pre-planning. And unfortunately, Sarah's not with us today, but maybe we can share the recording with her. And thank you, Cami, for sharing more resources for us. This is wonderful. And so I'm naming Cami my honorary co-facilitator today, sharing lots of data and resources today. Thank you, because Sam and Christian couldn't be here today. So thank you, Cami. This is great. And you all have supported with tech support to support Maria getting into the Zoom call, and eventually it worked out. So we did this together. We absolutely created this organic partnership. So that's super awesome. But I want to actually save the rest of the time for you all to just have some time to discuss how to wrap your mind around this and what you're thinking as first initial thoughts of how to go about this. And I'm just wondering what it might look like to collaborate with the 3 coalitions to collect some of that general foundational data and decide within the 3 coalitions which is the best resources to utilize for some of that data, so you're all on the same page. And then looking at some of that individualistic unique data that you might want to capture within coalitions. So I had a couple of reflective questions to think about here. So you can think about it, and it just might drive us into the discussion. But I really wanted to celebrate and think about what are some of the differences between your coalitions and the strengths or similarities. And then we can kind of just have the rest of the time for you all to drive the discussion on what that might look like to pre-plan together and collaborate. So I'm going to give the floor to you all.
Our Sarah is really good at data, so I'm gonna let her
Man, I
do
feel
that.
like I saw her come off mute. I don't want to call you out, but
No, I was, I don't know if it's directly related to your most recent prompt, but I was, thinking about the data sources and thinking about community assessments we've done in the past. And I think one thing that's really helped me like frame the data is thinking about like, what are we trying to see in it? Like, I think it's really easy to get wrapped up in, I need like this data point. And so it helps me to go back to like, why do I need that data point? Like I'm trying to think about like the most recent community assessment we did for our Head Start grant. We were trying to get information. So I think it was like some different health statistics for kids in the counties we served. And, we couldn't find like the exact data point we wanted, but we could find, okay, this percentage of kids are on Medicaid. This number of children have a primary care provider. Maybe one other data point about like immunizations. And then we can kind of say, looking at these 3 data points, this leads us to conclude that these areas don't have strong access to healthcare. So it's not always finding like the exact, you're not always going to find like, I want this perfect little data point. You might find 3 points that kind of wrap around it. And I think then it's okay to say in a community assessment, like looking at these 3 pieces of information together, that leads me to conclude that here's a gap in our community, or here's a resource that's really powerful. And that it's always helpful for me to like frame it around what am I trying to get to? Otherwise, I think you can just be in the weeds forever.
Yeah, the weeds, right? The rabbit hole for sure. Thank you, Sarah. That's a really great way to frame the thinking too.
And then would we want to back that up with evidence-based articles, like journal articles? Or is that not necessary? Does the data speak for itself?
Yeah, so when collecting data, you have permission to collect it, then permission to share it, and then you can reference it. But you don't necessarily have to share the article itself. But if you did, generate that data from an evidence-based article, you could absolutely use it and reference that data.
And I know when we've done it in the past too, we just include like almost like you're writing like a term paper.
Yeah.
Like here's my citation page at the end. Like here's all of the data sources that I referenced.
Okay, that's what I was asking. Okay.
Mm-hmm.
And then going back to your question about the strengths of our group, I think we have like 2 sides to one coin. I think it's really great that we're focused on home visiting. I think that will help us, I guess, just press forward with home visiting in mind and wrapping around that one topic. But that could also give us maybe a little bit of tunnel vision because we want to make sure we're looking outside at the whole family.
Mm-hmm. So I'm going to just quickly share to the reference page in the Community Assessment Toolkit, just, this wasn't even referenced like APA or MLA style, just really given credit. So just making sure at least we give credit to those resources we pull the data from.
I think one of the things that does bond us, I mean, that does make the whole group is that we're working for the children, even with STEM, you know, or STEAM.
Mhm.
With the Explorer people, we feel like, I think, you know, Cuidando los Niños is working with a lot of the home visiting agencies in town too, because I've gone to Cuidando los Niños to observe, you know, to do a visit with one of my families before. So it's kind of like it all is intertwined. So I that's how I see it. It's in similarities.
Absolutely. Yes.
Yeah, I would say so. I would say that as well, in that thinking about all the work that we're doing, whether it's home visiting or, you know, the STEM work, or, you know, it's, for me, I feel like I see it as a preventionist, I see it as primary prevention. You know, we're doing upstream work, and I feel like that's important to keep in mind as we're doing this assessment and as we continue forward, because that might help us frame maybe our measures or frame our goals, or just something like that. But, you know, because I've heard home visiting specifically mentioned in prevention groups where they call it primary, they're
Mhm.
seeing it as primary prevention, and it is, you know, a lot of the work. So I feel like that's something that we have in common and that we can, I think, really utilize as we're moving forward in our planning.
Yeah. A parallel to, and I agree with that sentiment of home visiting being preventative work, and also being that first, you know, point of contact for many families of the world of early childhood. So I just, you know, want to give that shout out, you know, because home visiting can work with families before baby's even born, and then they can be the ones to refer to all of these other resources such as education, intervention, and other community-based resources. But moving on from that, oh, Catherine said her internet's unstable, so she turned her camera off. But also thinking about how early childhood, in the field of early childhood, is also a preventative kind of field as well, because we are setting up children for success, for education, from, you know, K through 12 and beyond, and their skills and their social emotional skills and their developmental skills for when they are parents, right? So we are really breaking generational trauma, and the whole field of early childhood is a preventative model, right? And it's just a beautiful, beautiful thing to be a part of. Yeah.
Definitely. We're building the bridge before they fall into the river. Is everyone familiar with that prevention analogy? It's like, why are they falling in the river? Instead of just pulling everyone out, go upstream.
Yeah.
Why?
And it's hard to take yourself away from, but babies are, you know, thinking about this analogy. Babies are dying and drowning in the river. I need to save these ones right now. But what's causing them to fall in the river?
And, you know, last week, the Northwest region, and actually every region of the state for health promotion, are hosting our health council kind of gatherings, because it's one of our primary focuses in health promotion to work with the health councils, which there's health councils all over the state. And we just had one last week, and that was our theme. It was, what was it? Upstream, making upstream work mainstream, or something like that.
Oh, wow.
But you know, we did the 5 whys, which is, you know, it's the root cause analysis, and there was a lot of conversation, and we asked health councils to bring their priorities, and a lot of them were talking about early childhood, you know, maternal health, a lot of these things that we're talking about as well. So I don't know, I guess we don't really talk a lot about health councils, but I feel like that would be a really great partner to have.
Definitely.
A lot of the work that they're doing really kind of aligns with what we do as well.
And I think Cammie, you were off mute.
Oh, yeah, I was just gonna add, like I'll put it in the chat, but growing up New Mexico shared with Paloma and I when we were in like a quick little meeting, a really cool needs assessment that ECCD did. I think it's from 2020. And if you click on it, and I mean, there's a lot to read, but if you just like scroll pretty much to almost the end, or each county, because they highlight each county, it shows you kind of a good example format of a community assessment. So it's like very visual, right? So like, I'm sure we've all read like reports that are just very black and white and like mundane with numbers. And what I liked about this, it's a needs assessment. So what I liked about this needs assessment was it's very captivating visually. So it's easy to read, it's easy to understand. It includes the visuals. But it also includes some of the information. This is again from 2020, not in the last year or so, but it includes some of the information I know that a lot of us will be looking at for the community assessment. And it might give us an idea if we read like their summaries or, you know, like just like a little like a template spinoff. I found that pretty, like, as soon as I read that, I was like, oh, okay, it like kind of clicked on what our community assessment roundabout should look like. Like what's the, not just the goal, but how do you deliver it? Like, right, like how do you make it not just something that's interesting, but also like the aesthetically pleasingness to these are pretty amazing. And so yeah, I just wanted to share that. I printed off a hard copy just to have in my office. It is like 300 pages, but it really does show you a breakdown of a lot. And it also includes where the data was pulled from. Because for the community assessment that we've been working on here at Quedando, one of the things that I've discovered is I've been using the US Census for a lot of the national and state data, but I'm cautious because I'm cross comparing what I'm getting from the US Census to like our own state's data, just to make sure that the numbers line up, right? And then in the digitized assessment I sent to Lindsay, next to each data point with what was put in is a shortened link to the actual, like the direct page of where the data was found. So that might be something good if for everybody else who's collecting data, just keep those links of where you're getting the data. If it's, you know, like a website or something, that way you have a reference to go back to, should you need to explain where you got this number from. It's been a very helpful process.
That's great. Thank you for sharing that. And that's a really beautiful assessment. Of course, yours doesn't need to be quite that in depth, of course, 300 pages or whatnot. So don't, you know, get intimidated by it. But also I love that you pointed out, Cami, the visual piece and making it easier to read, and that you can, you know, if you have releases to utilize photos of families or children, you can use pictures to tell that story of your community. Yeah.
Would this be something we could use? I don't know.
Yes, that's exactly what I was referring to.
Because I was having a bunch of data in here.
Yes, and so that's already been, it's already been approved and released and shared publicly, but just to verify, I would check with the data team and manager monitors and just say, let's say, is that from 2021? So I would I'd say, hey, data team, hey, manager monitors, we're working on the systems building grant. There's really great data in here that we would like to include that's relevant to our county and home visiting and whatnot. Is this able to be publicly shared within our community assessment if we reference this piece of assessment material? I lost my words for a moment. Cami said she also created a live running note doc for this meeting and will share with anyone needing them. Smiley face, she's amazing. And leave your email if you didn't include it above, and I will get it to everyone by midday tomorrow. Thank you, Cami, so much. You're such an awesome resource. We really appreciate that. One thing that we did when we were working on our community assessment after we surveyed for Head Start, and we were then moving into strategic planning and also just compiling all of that data, And this was before the Zoom days, right? So we would get together and we would, like, as leadership within Head Start, we would have a sticky party and we would all review the surveys and some of the, major takeaways and themes that we saw and gaps. And we would create categories on a whiteboard and we'd put like different stickies of certain data points and whatnot under these categories. And so it was kind of an interactive way to start to look at strategic planning. So then we would say, oh my goodness, there are, 50 stickies underneath unemployed families, having someone that's unemployed in their family. That might be something that we can support on workforce development within our families. But there's a way to do that electronically too, and you can come up with creative ways. And that was our way of doing the data walk. We were sitting down, looking at the data, compiling it, kind of noticing those gaps, noticing trends, noticing strengths that we wanted to highlight in our report. So we can highlight strengths of families like resilience, or, let's say we found a data point of graduation rates compared to this past year compared to like 5 years ago. Wow, that's a strength. We've increased in graduation rates, hopefully. I don't know that data point offhand, but so there is more than one way to do the data walk. And however your coalition comes up with a plan, or using this data walk as, a framework is really helpful to guide what we're doing in that process. Yeah. Well, we're coming up on 2:30. I was just wondering, just briefly, if anyone had any takeaways from our session, or things that you might even want to explore a little bit deeper with your liaison going forward, or each other.
I really liked what Diana said about the visiting being the primary prevention. I think that's something I'm going to take away from this video and use it all over.
Yes.
Everywhere.
Own it. And know, again, in that parallel, that being in the early childhood field, that we're all a part of a larger scale preventative model.
Yeah, I think it's just, as we're moving forward, and, thank you, Cami, thank you, Lindsay, thank you, everyone who has shared so much in this short amount of time that we're together. I'm hoping that we can take that with us as we move forward and just continue to work together and lean on each other, because we all have different strengths and we all bring different strengths with us from our organizations. So I think I know that would make me feel happy moving forward. So
great. Thank you, Diana. Anyone else?
I just wanted to say that I'm so amazed and very proud of the community that we all live in, as far as even our state, just coming together and collaborating for like pretty much one common goal, which is the children, which is our families and overall our communities. Because there's something in data research called the God effect. It's mostly like scientific research, but in all honesty, it's where you pretend that you are outside or above, looking in on the study or the data or the assessment or whatever it is you're doing. And the reality is we're actually in it. As much as we try to like push ourselves away to be like, we're on the outside looking in, we're really affecting the data in some ways. Sure, like raw numbers, right? The quantitative data, we're not really affecting. The numbers are right there, right? But when it's the qualitative, when we're talking to families, when we're reaching out, when we're networking, in all those different ways, we are impacting and affecting the results that we're getting. But recognizing too, at some level, that we all have the same passion behind that, and that we're all collaborating for mutuality, which is a huge thing that Paloma and I talked about with one of our learned outcomes that we wanted was mutuality, which is just being able to collaborate with other organizations, stakeholders, community partners. Because I mean, pre-pandemic, there was so many turf wars that I was a part of, well, not a part of like directly, but just that I saw between organizations, nonprofits, K through 12, early childhood. It just wouldn't stop. And it was like, if we all could just take a minute and recognize we're all in the same team. We don't have to fight for resources when we all have little pieces of these resources. It's like a puzzle, right? 100-piece puzzle. Each of us has a few pieces, right? So we don't need to like Hunger Games this and try to go at each other to get the rest of the pieces. We could all sit down and just put them together. And I really appreciate everybody here, and just thank you for your hard work that you're putting into the community, because it's not just showing as far as, you know, children or families, but like I have a family here in Albuquerque. My daughter has gotten support services. You know, all of us know, either ourselves personally, a family member, or someone we know has reaped the amazing benefits of all the hard work that we're each doing. So thank you so much for that, y'all. Like, it's amazing. It's beautiful.
Thank you, Cami, so much. And thank you for your co-facilitation and sharing amazing resources and those beautiful words. And without completing the puzzle, because we all need each other, because we don't have the capacity in one agency to do it all, right? We need each other. We need the whole puzzle together, right? And that is so, so beautiful to think of. Thank you. Anyone else? I want to make sure to honor your time, but I also want to honor your takeaways if you have any.
Just a side note real quick, Lindsay, don't forget to put those dates down. I know that you
Oh, yes.
Catherine
Thank you.
asked
Yeah.
about them, but we never got them. So
Thank you. I will. Okay, well, if there are no other takeaways, you can hang out until I throw those dates in the chat of our deliverable dates. If not, thank you so much for joining us today and your partnership and collaboration. Actually, you know, facilitating this group today together, because without your discussion, sharing resources, you know, we wouldn't have the learning dialogue that we did today. So thank you so much for joining me. And it's really been a pleasure. I'm humbled to work with you all. And I just thank you for the work that you're doing for our communities, our children and young, or our families and young children. Have a great day, everyone. And I'll be posting those dates. Just a moment.
Cami and Paloma, we'll see you next week.
See you next week.
Okay.
So,
hey, Lindsay,
yeah.
Liz, our mental health director, she did a mindful exercise for us, and it was the Darth Vader deep breathing, which is because today was May the 4th.
Oh yeah, May the 4th.
So it was so cute. It was like breathing real hard in your head.
Oh, that's so funny. I love that. She is awesome.
Yes.
I loved that presentation. In fact, I was telling the rest of both Janelle and I were telling the rest of the group, we would love to have her come and like present to our group. She was amazing.
Yeah, she's really good. And
oh my gosh, I should have been more creative.
No, that's what she did that yesterday. She's like, in the lieu of the 4th of May, we're gonna do this deep breathing tomorrow. I was like, oh, that's so cute.
Oh, I love that, because actually there's a technique in yoga where it is that breath is called the Ujjayi breath, where it almost sounds like a snoring, like in the back of your throat, like Darth Vader. So that is really, honestly, it is a ancient technique, and she is amazing. That is so cool. Okay, so here are these dates. There you go. Just so you have them handy. So again, that community needs assessment was originally due in, I believe, June. But because the funding came out a little bit later than expected, they pushed that back until August. And so kind of our guidance is, our best thinking is to think about if it's possible to try to have it done maybe by the beginning of August. So you have maybe a couple of weeks to make any last minute tweaks or edits, and then thinking about how do I turn that in so it gets in on time, you know, internet glitches and things like that. But so thinking of those due dates and backward planning. So when do I need to have, if I'm going to do any sort of dialogue sessions or conversations with families or host anything like that, when should I have that so we can get that done? And if we're going to do any further data collection after we collect data that already exists, when should we have those surveys done? So thinking about that, and then also the data walk process and doing some sort of process where you are collaborating that data and compiling it, fitting that into your timeline as well. Thinking about that.
Okay,
Thanks, Diana.
Lindsay, one of the dates they mentioned was June 30th for the first report due. Is that not a date then?
Yes, so that will be, they're looking at doing reports. And I think, Cami, do you remember, Teresa, was it going to be monthly?
Yeah, she had called them, what did she call it? Pulse checks
Yeah,
instead of
yeah.
reports. And so from what I understood when she was sharing, they're just check-ins. It's not like a formal report, like it's
Okay.
nothing big and outrageous. It's just, you know, they want to check on us to make sure, like, not micromanage. I truly believe it's definitely
Yeah.
a care aspect of, you know, where are you? Because when you think about it, when Paloma and I were coming up with our timeline, because we discussed a timeline for this, we decided August 1st was when we wanted to have our, similar to like having most of everything done for the community assessment, just to give that 30-day leeway, because teachers are out of school, people are on vacation, the summer months can be challenging with some of the holidays coming up. And so really like building the contingency, that was important. And so I think ECCD is also on the same page of wanting to check in and get feedback of, you know, if all 15 grantees come back with, no, we're like trying our hardest, but there's no way, then I think they're going to reevaluate those dates. So I think it'll be very important that we give honest feedback in those pulse checks.
Mm-hmm. And really, you know, I love, thank you, Cami, for pointing that out, that it is just a pulse check, not a report. So Maria, thank you for remembering that date, but it is different than the deliverables. That report will just, again, be this pulse check just to see that you are on the path. So it would be like, you know, ABC Early Childhood Coalition held monthly coalition meeting. ABC Childhood Coalition held a family conversation session to see you later, Teresa, to gather more information, you know, qualitative information and stories or whatnot. And just what you've done that week or that month. And I put kind of an idea in the chat of maybe some points you might want to write about, but it's totally up to you and your coalition and what you look at for that format. It doesn't have to be super detailed, but you know, are you a new or emerging coalition or re-emerging or established? And then your coalition's name, the month and the year, of course, your coordinator's name, you know, if there's any updates on the position. It seems like most of our coordinators have been hired now throughout the state, so that's exciting. But any updates that might occur with that, when your coalition meeting is and the frequency, maybe who attended, or even just a gist of like, we had 3 members from the Department of Health and 2 members from this organization. You don't necessarily have to list attendance or anything, or maybe even just, we had 12 people attend our coalition meeting with representation from families and PED, etc. And then also talking about things like collaborative leadership. So this is one of those things. So we came together and had a coaching session, and we are forming collaborative leadership within our community. We're building our system right now. We're building relationships. You attended this training would also be another piece, this coaching session. So I called it, I know I had to get really fancy with my name here. Let's see. A community assessment toolkit discussion-driven coaching session, because I really wanted a lot of, thanks, Catherine. I wanted a lot of the discussion to happen from you all, you know, and I wanted to see where you all were at, because again, we had this kind of brief introduction to the community assessment toolkit. So I didn't want to assume that we need to just start from scratch for everyone again. But I didn't want to assume that everyone felt fully comfortable with it either. So I wanted you all to drive that. I wanted to meet you all where you were at and the needs you might need. So yeah, and then just some brief deliverables updates. You know, what's the work that you're moving towards with collecting data with the community assessment tool, or sorry, the community assessment, and any other performance measure activities, which we just have a loose idea of performance measures right now. So that's family engagement, early childhood knowledge, services alignment, collaboration, leadership, leveraging of funding or resources. You know, you might even think for your coalition, yeah, we'd like to have a coaching session for the core team or leadership team, or we'd like to have it for the entire session of some sort of collaborative leadership session to really build the foundation of our group. And so that would be something that you know, connected with us or another organization to facilitate. So you all are doing amazing work already. It's just a brief little check-in, pulse check to capture some of the work.
If we grow our group, like for example, there used to be a South Valley Early Childhood group, which kind of dissipated really before the pandemic, but that was quite a few people. If we reach out to them and ask them to join our group, that would be something we'd want to express in the pulse check-in, saying that we're growing our group.
Yes. Oh, good.
And, you know, adding community collaborators to the group.
I have some community responses I just saw from the 100% that I will pass on to you for data from Bernalillo County. Yippee. But I was looking at that. Oh goodness. Yes. And here's the Child Care Next New Mexico's policy roadmap. But the reason I was looking at that is because Sam shared with me yesterday. It was from a while ago, but it was from that organization that you mentioned, Catherine, in the South Valley, and just an idea of what they were looking at, not necessarily to utilize the data because it's a little bit dated, but an idea of what they were looking at, what was already established, to really understand the history of, you know, early childhood and coalitions within Bernalillo County too. And then, like you said, reaching out to maybe some of those folks that are still involved at some level or another. How can we wrap them into our coalition?
Just because Bernalillo County is so diverse.
Oh my gosh.
And I suppose every county is, but I mean, we have the largest school district in like the world. And, you know, and so, you know, such diverse ethnicities and socioeconomic status, even between the different areas in the one county. So I just think more people from different groups could give us a really healthy perspective.
Absolutely. And we don't want to forget about those outliers too, that are in Bernalillo County, because we often get consumed because there's so much here and so many people here in Albuquerque. So what about Bernalillo County? What about, I don't know how far into the East Mountains Bernalillo County goes. Tijeras maybe, and some of those other smaller communities we don't want to forget. So we have the large metro region, but also rural, very rural communities. And even in the South Valley, there's very rural locations and communities. What is it called? Parajito Mesa, that community, that's way out there. Yeah, we don't want to forget about them.
Yeah, because they're a community school. They used to be part of the South Valley Early Childhood Group. So yeah, drawing on those resources. Okay.
Great, thanks.
I wanted to just add something really quick too. Like when we were talking about like numbers and making sure that like we can be data informed versus data driven. One of the things I'm going to be doing next week, and I'm so new to having like, I usually contract, I've been a contract advocacy individual for a long time. And so having like an office job is a lot different. And so I need to check with my supervisor and just kind of make sure low key that this is okay. One of the things, like I grew up in a really, really poor area of Seattle, Washington, and I was homeless as a child until I was 12. And so like my mom had a learning disability. So there's a lot. We didn't have a car. Seattle in the 90s, not the best supportive resource place, right? And so when I was looking at data the past month, one of the data points that Paloma and I decided we really want to try to dive into is transportation, right? So how many families are there in Albuquerque and in the South Valley that have children under 5 that do not have reliable transportation? And a huge piece of this is in my heart because as a child, how food insecure, right? So home insecure and food insecure go together. Food bank, beautiful. But when you have to get on a bus or 2 buses to get to that food bank, and it's just your mom who's older, who has a learning disability, and you're 5 years old and you can hardly carry 2 bags of canned food, you might, the food bank might have the boxes for you, but you can't take it all.
Right.
And so something really important to just recognize in that is, even if there is transportation services, right? Like for like public transportation, getting to the places, being able to physically see in front of you, how big is this box, right? If it's a multi-generational home where maybe mom works like 12-hour days, grandparents are primarily responsible, food bank opens at 9 in the morning, can grandparents take 2 buses with 3 children under the age of 8 across town to get to the food bank, to get the food, to come home, right? So like those are those gaps that we're starting to notice, even with some of the stuff we're looking at. So next week, I'm gonna actually be going, I'm gonna wake up and I'm going to go into the heart of our community, and I'm going to take the bus all the way to the nearest food bank. Don't know where it is yet, haven't even gotten that far. I'm gonna track how long it takes. I'm gonna see what obstacles there are. I'm gonna add, I want to add in more things, like additional things that could be obstacles, because it's one thing to see the numbers, it's another thing to look at a map. Even surveying families, that piece is crucial and important, right? To hear what they're saying, that's the struggle, right? We might not be able to fix, the Albuquerque metro, right? But that's going to give us an idea. Well, maybe we can coordinate with food banks for food deliveries, right? How can we also come up with solutions? And I'm just curious because I want to see what that's like. And not just that, but other things in the community, right? How easy is it for a new mom, right? She's going to have a car seat with her with a newborn baby. Maybe she's going to have a 2 or 3-year-old next to her. She's a single mom, right? So that's a 10-pound car seat baby, right? Getting on a bus to go to WIC. Is that possible? Right? The daycares, if they're only open from 7 a.m. to 4 p.m. and yet she has a 3:30 appointment for WIC, because we know some of the WIC offices are definitely back-to-back, like appointments and scheduling can be hard right now. Can she even make it to pick up her child? Or does she have to keep her child home from daycare in order to make it to the appointment to get the needed necessities that she needs, right? And I think that's part of that community engagement piece. That's more than let's remove ourselves from the office and actually go into the community, and it will give us a different look at things, a different and a lot of this comes from my experience as a child, because in this field, especially in Washington State, once I got into college and started advocating, I was a teen mom. I had my daughter at 17, she's 13 now, and I felt always unheard. I'd go to committee meetings. I sat, my daughter also was in Head Start. I was part of the parent, I was our parent advocate for our council. but nobody would listen. I mean, it was just so funny with lawmakers or individuals who just have never experienced it. Do you know what it is like to take 3 buses to get my kid here to daycare, then to go over here for this doctor's appointment, and then yet I just lost my benefits because I had to make a decision. My daughter was sick. Do I send her to daycare, lie, right? Or like, how do we do this? And it was just frustrating not feeling heard. And I love that this community assessment is going to be based off of also hearing the voices from the families.
Yes.
And recognizing and also owning the privileges that we do have, like, right, this
Yes.
is systemic. And I am proud of where I am today, but I would be lying through my teeth if I said I wasn't afforded certain privileges being white than other individuals in the community. And when we talked about at the conference being equitable, we need to move past equality. Equality is great. I'm married to a woman, woohoo, like, I'm so happy for that. But at the same time, that doesn't really do me anything if I'm looking at things that are going to be equitable versus not, you know, in things that pertain to same-sex relationships, right? So that means that as we're doing this, it's not all about equal, right? Just because the Northeast Heights, which is where I live, has their bus stops are literally, there's one in every block going down Montgomery. You go to the South Valley, and sometimes you have to walk 3 blocks just to get to the next bus stop. Okay,
Thank you.
so
Yeah.
okay, cool, we can make it equal, but let's actually let's take a step further and make it equitable. And I am so excited. Sorry, this is like my soapbox. I'll get off of it because I want to respect people's
No,
time.
speak,
But,
sister,
like,
speak.
that is the thing, like, when I did a breakfast at New Mexico Can yesterday, and it was just phenomenal because it was nice to hear and network with individuals from so many different areas. And I loved the diversity of the individuals there, the youth leaders. That was so crucial because they're networking with other people who might not have even been in their shoes before. And now they have a different perspective. And oh my God, I love this, Lindsay. I love this little thing.
Have you seen it before?
Yes, I have it printed out.
Well, I think it's so fitting because we're early childhood and we all know the giving tree in the book. And yeah, I just love this. So we, you know, as you were talking, it really made me think about justice, social justice, and what does the difference between inclusion, equity, equality, and justice really mean, and what does it look like? Yeah. Yes. And then we think of, thank you for being vulnerable and sharing your story, your real life story, and opening our minds and hearts to think about some of those possibilities, where sometimes we get the data, the numbers, or sometimes we get the story, but we don't even think about the other perspectives, the other side of things, you know. Oh, well, we have food accessibility issues, but we have food banks. Well, they can't get there, but we have public transportation. But what's it really like to engage in those services? And we, you know, sometimes people make swathing comments of, well, people just don't want to work. But what's it really like to get on 3 buses to get to work when I have a medical degree as a doctor in another country, but because I'm a refugee, like pointing out the conversation this morning, I can only work in a restaurant and wash dishes in this country, and I can barely make ends meet doing that. And I'm a single parent and I don't have childcare. So all of these barriers. So is it really that I don't want to work? No, I want to work, but it's just so hard to get everything aligned so I can get there and be there on time and be there and be present. And oh my gosh, I mean, we could talk for hours and think about those things, but I think about the people that live in the shadows. I live in the South Valley. So what you're saying is true about, you know, access to public transportation and services, and to folks that maybe live in the International District or in my own neighborhood that just do not feel safe signing up for some of these services as well. They don't feel in a safe space to do so. So thank you for the reminder of those different perspectives, and how can we experience it? Talk about lived experience. We can hear it from families and we can live it ourselves.
I honestly, like, when we were talking about the qualitative data, and we were talking about like words, right? Like it was when we started talking about the report that's due in a month. The report, it reminded me of the conference. Half the people in the room heard report, and I mean, we all know where like our brains went. If you think of a report like a report, we're like, what? And the other half, yeah. And then the other half, we're like, okay, cool, like it's an update. And what's interesting is it was a word that was used, but because of our different backgrounds, our various fields we work in, or right, different like just how we, even the language we speak in the workplace, right? It's that little piece right there was so crucial. Well, so for qualitative data, if you're interviewing a family and you're asking them, well, you know, how accessible is it to get to the grocery store without a car? And they might say, oh, it's really frustrating. It is actually really hard. You have to recognize at some level your privilege, right, of your lived experiences are about to tell you and decode that in communication, right? It's called decoding and coding. So when they say it's hard, whatever your view of hard is, that's where you're going to go. But the reality is that means that we could actually be on two different levels. So like, you know, my wife can say, you know, having to take the bus, you know, when we were on vacation in Seattle, that was kind of hard. And I'm over here like, no, what's really hard is when you live in a rural community, you have to take 4 buses. Like, what are we talking about? And so it's important to also recognize that, so that we're not undervaluing, right? So wow, that is hard. That's why I want to go and I want to ride the bus to a grocery store. I want to go to the WIC office. I have different things that I want to try to do on the weekend and during the week because of bus schedules. But also to really get a grasp when I'm going to be talking to families in a month from now, and they're going to be telling me the difficulties of transportation, I at least have some ability to like connect, right? Because I mean, I grew up in Seattle, so you know what? The buses in Seattle do run every 5 to 15 minutes. So I can sympathize and empathize, right, with the frustration of not having a vehicle. But I don't know if I can actually empathize yet, because I don't have that learned experience of having to wait an hour. What if I miss my bus? And then all next week, I'm also going to be taking my bus from the Northeast Heights to work every day. I want to see how long does it take. Well, I already know now because I looked up. It's going to take me about an hour and 48 minutes with 2 bus transfers just to get from Wantabo and Manal to Cesar Chavez and the freeway, because that's where I work, right? And that's okay.
It reminds me, Cammie, this person, I don't even know who it was, shared this post on Facebook last night. I happened to see it kind of late at night. It was about a family in the North Valley that mom had the baby's in NICU. She kind of split, and dad is really involved, but he doesn't have a vehicle. And he's living with his mom. So when baby's discharged from NICU, she'll be with dad and at grandma's house. And in this post, it said, you know, we'd like to get the basics, you know, donated to this little one, like maybe a crib, even if it's used, and, you know, some basic things like that. And they also said that dad is currently unemployed, just was incarcerated and recently released, walks 2 hours one way to the hospital to see the baby every day. You know, and I don't know what public transportation looks like for them, but I'm sure it still would be at least an hour, you know. But just to like, wow, you know, this. And so I actually reached out to that person. I don't even know who they are. And I was like, do you know about home visiting? And here's the Moments Together site. And you all can look into childcare, early intervention. I'm sure the baby would qualify for early intervention, and those services to really support dad and grandma. And at this point, you know, home visiting can, you know, educate dad on safe sleep and provide a bassinet. And, you know, some of those resources can be provided from that. And she said she was so appreciative, and she's like, I didn't even know how to get on these services. And I was like, well, you can also talk to the social worker at the hospital, and you know, they can help connect you to some of these services as well. But like, just a little, you know, one, it was a recognition for me of, you know, getting to and from, and 2, it was recognition for me that, you know, these services are not widely known, or how to access them are not widely known. And 3, how just a little tiny bit of, you know, time and information could really help that family. I was like, wow, 2 hours.
Yeah, sometimes I forget that because I'm familiar with resources, not everybody is.
Yeah,
Right,
that's a
right.
good point.
That's huge, huge. And then you have a family living in a car and you're telling them, go get the resources, go get food. Okay, they go get a box of food and they bring it back to their car and it spoils.
No
It's
refrigerator. Yeah.
refrigerator. So what do they do with the food? You know, that my daughter came across a family like that. And it's like, what do they do? And not everybody can get the resources because they don't have a phone or they don't have internet. So you're stuck.
Right.
That was a big piece too of, so for our Early Childhood Coalition, like recognizing like childhood homelessness and insecurity and housing insecurity is, it's deep, right? Like when someone says the word homeless, I mean, we're all advocates, right? So we have a different maybe view, right? But in just natural society with all the stereotypes and biases that we're born into and that we grow with, when you think of someone who is homeless or experiencing homelessness or housing insecurity, I don't care who you are, like you have a vision in your head, like we all have it. We all have to work hard to unpack it, right? And so that's where the we're trying to bridge that gap, right? Like I remember I spoke to someone in a political event about 1.5 years ago during election, and they said, well, CYFD would never let a child be homeless. And I got curious. I always get curious with individuals about this topic, about any topic really, because I mean, I guess they'll be like, no, that's not true. And that really doesn't go anywhere. I get curious, like, okay, like, you know, when you think of homelessness, what are you thinking of? Like, I really genuinely want to know. And then I sometimes will share my story or my experiences with other families who are going through this. And the basis is, it's just like, as a child, we know a child who's food insecure, right? It might not be that they have zero food in their home right now, but the problem is they don't have a way to be ensured that that's going to be a stable and consistent meal every day, right? And that's the same thing with housing. So couch surfing, staying in motels or hotels, doubling up, right? So you have like 2 or 3 families living in a small apartment, right? All of that leads to housing insecurities and all these other things. And it's interesting when we can try to like break that barrier. Something I've been trying to work on just privately, but before getting hired this position, was something I wanted to call like through their eyes. And it sounds weird and I don't know anything about it. and it's just like an idea, but to get the point across, you know, we can talk to parents and families. And right now, like we've all had the conversation with someone, I'm sure, who leans either more conservative or again, Lindsay, like you were saying, like, well, just get a job, right? But what I'm curious about is we all can say universally, right? A child who's 4 can't work. A child who's 3 years old cannot work, right? So what I wanted to do was collaborate with local filmmakers to see if this would even be something that can be possible. I don't know what to do with it, but it would be amazing to have, and a few families, if they were open to it, let us utilize like, you know what GoPros are, right? And just a day, like a day in the life of a 3-year-old who lives in their car, a day in the life of the 4-year-old who has to get on 2 buses at their level, through the eyes of this child, the height, right? You're thinking of a 3 or 4-year-old is not your height, right? So when they get on the bus, they sometimes can't look out the window. So they're just staring at their shoes for 1.5 hours, or they're falling asleep. I like can remember vividly my own images of this as a child. But I want to know more. I have these thoughts right now. I want that. I don't know. I just want that to happen because I think we could, and I want it to be silent. Like, because as people are visually taking in images and information, you're processing it. You're processing it against every single bias you have ever built in your life. And you can't argue through the eyes of a child. You can argue all day with adults and the decisions they make. You can't argue with a child who has zero control over their living situation, how much money they make, the clothes on their back, their parents' job. You can't. It doesn't matter what political party you're affiliated with. It doesn't matter your socioeconomic status. It doesn't even matter your core beliefs about working and work ethics and the workforce in this state. Because the bottom line is, like, a child is separate from their parents because they are a human being that deserves the same amount of respect as the children that we tuck into bed or the children that we're teaching in school. And so what better way to to really try to like make that viewpoint lifted up through getting to see firsthand that experience of what a child through their eyes of this struggle. So I don't know.
I love
Just
that.
just an
You
idea.
should write it into your grant.
I was
funded.
thinking about that, and for the data walk, I'm working with a photographer. I wanted to, this is something I wanted to actually bring up, Maria, next week when we meet. But for the data walk, what strikes me is visuals, right? Visuals, visuals, visuals. You normally would have, each of our indicators up, and then that's where sticky notes get involved. But what if on our, either on the actual poster boards we're using for our data walk, or even right above them, depending on obviously where we do this, I don't know. There were images that were captured in black and white photography of the exact indicators we're talking about at the child's level, because we're all here.
Perfect.
And that might also, like, different stakeholders, inviting them, community partners, other organizations that might have a direct impact on certain things, having them not walk through, sure, don't even look at the numbers, right? Because some of us are so like numbered out, it's not even funny. But look at the images, right? Look, this teen mom, right? That's one of the indicators that ECCD actually recognized, was teen parents who have children under the age of 5. I was teen mom. Yeah, it's not pretty. Like, trust me, like I would love to be able to connect with someone, right, who's a teen mom with a kid under 5, and just offer something and say, like, would you be, it's okay if you're not willing to be vulnerable, because that's a respect thing inside. But if you do want to, like, that would be amazing to have to share. And that imagery can come together in a very beautiful way, and it can be used digitally too. But it might also give a different perspective than we're used to, especially in this field. I mean, we all know legislators get bombarded with postcards and letters and paintings, or signatures and petitions, and tons of us going up and testifying on behalf of this bill, that bill, these needs, those needs, right? But giving them just their own seconds, people in the community, to just fully take on that. I think that could be something, I don't know.
I think it's great. I mean, a picture will say 1,000 words. You don't have to say much. That little girl that my daughter met, she came to apply for, she was in the Christian sorority, and she came to apply for it. She was homeless. Her dad was schizophrenic. The mother did not want to leave the family car because that's where the dad knew where to come. She had 3 brothers and sisters that were living in the car with her. She was going to UNM and getting her degree, but she would shower at UNM because that's the only place she could shower. And the little kids, they would take them into Wendy's, because she worked at Wendy's, and Wendy's allowed her to give the children a bath and would give them food in the evening for the family. But she did not want to leave because the mother did not want to, she wanted a place for the dad to come back. And he would come back, and he would have a job for 3, 4, 5 months, and then he would get sick again. And it was just a cycle, but nobody was there to help him, because they wouldn't go to All-Face. I mean, not All-Face, to Junction, what is it called? Joy Junction.
Joy Junction.
Yeah, and they had to have a place there in order for them to help them. Well, it was just really sad, really sad. But to watch that child go to UNM, take a shower, but to visually see that, what she had to do to try to make her life better. And I think pictures are amazing. I think, Cami, you're right on.
That was in part of a project that my wife and I, we had started back when the pandemic hit, because there were tons of kiddos, right, who depended on school lunches and school meals. And the interesting thing, right, I was a school lunch kid, is that, like, at Title I schools that offer that, and the families that need the access the most, they don't have reliable transportation because they're busing their children in. And I was like, there's a gap here, because how are the kids who need the most going to get the meals if they can't walk, right? Because they're not within walking distance. And so we started a community project through the Next Door Neighbor app, and we got to partner with PB&J, and we were helping 4 to 5 families a week with 2 weeks of groceries, fresh fruits, vegetables, fresh meats. And we would cater each box and care package towards the actual family, right? So if they had an infant that needed soy formula, right, that's going to be different than if you have an infant who's just breastfed, and maybe mom needs, like, breast pads versus actual formula. Like, and so it was a really interesting and humbling experience because the community really got together to make this happen. And the Albuquerque Journal had reached out to me and they wanted to follow us around when we were dropping these boxes off. And I let them know, okay, I'm okay with that, but I'm going to check in with the families we're dropping off because they deserve the same amount of respect as you asking me that question. And so on one of the weeks, all 4 families were okay with it. And I will never forget that this kid, he was maybe 8. He had like an 11-year-old sister. Mom worked an hourly job, but she couldn't leave them home alone. So like she's a single mom. And, you know, she knew that she was probably going to get evicted. She had no transportation. She couldn't buy groceries, food, nothing. When we brought the boxes up, sorry, like this is like,
It's okay.
he got so excited for getting applesauce. Like, I mean, I have seen like kids get so excited when they are on Christmas morning, they get the PS5 or the new Apple phone. But like this little boy was just so happy. And there was no food in their fridge. And the Albuquerque Journal photographer took photos with permission. And he captured that little boy putting the applesauce in the fridge. And like, I have that saved on my laptop as a reminder of just when we look at joy and how children should experience joy. Sometimes joy for these children is just their basic needs getting met. And it has taken me probably the whole year, the last year of this end of the pandemic, to really truly like wrap my mind around the brokenness that we have, the gaps that we have. And it's like, one of my friends was like, well, why are you spending so much time making a community tool for everyone? Aren't you like, I know you want to share things. And it's like, yeah, because we have gaps and we need to like close those gaps. We all have the information and the puzzle pieces. There needs to be something to where we can just put it together. Like we have the ability to, and for some of us who have resources to do it, we need to do it. And yeah, sorry, like it's just.
Thank you. I think it reminds me too of that, no matter where we are, even if we are, you know, in the back of the line too, we all have privilege at some point. You know, we can reach back and help people to the side, in front, and that I'm just like, I want to buy that little boy a lifetime supply of applesauce every time I go to the grocery store, but it's just these real life lived experiences. It's just amazing. But I really appreciate your debrief and everyone staying a little bit extra, because these are just such powerful stories, and thank you for sharing so much. Anything else that you can think of, or shall we run back to our day-to-day?
I just want to say I sent the photo if you wanted to see it to look at.
I'm looking at it now. Wow.
Yeah, Cammie, I really appreciate you. And I think you're onto it. I mean, you really are. So we'll talk more next week during our meeting and we'll go from there.
Thank you so much.
Thank you.
You all are amazing.
well.
Thank you so much. So excited to work with you all and partner with you all. Have a wonderful day.
Lindsay,
Take
thank
care.
you so much.
Thank you.
Thank you.
Bye.
Bye.